Well, back here at home, 5 cases of dengue fever have been reported here in Travis County. This is a mosquito-borne illness that can cause nausea, vomiting, and even death in some severe cases. Dr. Desmar Walks with APH is joining us live this afternoon. Dr. Walks, first of all, thank you for taking time out on a Friday afternoon to join us to talk about this.
Thank you for having me.
Okay, let's first talk about how much of a danger is this here in our county, in Travis County?
Cases of dengue fever that we see have been linked to travel. We've not seen any local originating cases, so no cases that have originated from people that have been bitten by mosquitoes that are in our local area. And so we're hopeful that people will follow those guidance things that we've told them to use mosquito repellent, wear long sleeves, try to limit your activities at dusk and dawn.
Okay, and Dr. Walks, can you just walk us through the symptoms? What should people be aware of?
So most people are asymptomatic. 60 to 80% of people who have dengue fever do not have symptoms. Mild symptoms can be such as headache, nausea, pain behind your eyes, bone pain, fever, of course. But it can people can develop symptoms that are more severe and life-threatening.
So if people do experience these symptoms, they find out they do have dengue fever, what are the next steps? What are the treatment options? What should they do?
There's actually no specific treatment for dengue fever. The treatment options are to treat the symptoms with things like Tylenol and hydration. But it's really important that if one develops symptoms and has traveled to areas where dengue fever is found, that they go and seek medical care.
Okay, and lastly, is there any advice you would give people as we enjoy the heat outside? A lot of people are spending time outside this summer, they're going on vacation. What advice would you give them about really protecting themselves in addition to what you said?
So go and see your provider or go to a travel clinic to find out what the local diseases are that are circulating in the area that you're planning to visit. And be sure to take an insect repellent that's EPA approved to protect yourself from mosquito bites. Follow those precautions of wearing long sleeves, avoiding activities at dusk and dawn. If you're in a place where there's no air conditioning, make sure that you've got some screens on the windows. And if you don't, or if you're camping outside, use a mosquito net to protect yourself from mosquito bites.
Okay, Dr. Desmar Walks from APH, thank you so much for being with us this afternoon. We hope you have a great weekend.
You too. Bye.